And does the world see video or just hear audio? Got it. Because it says no audio is being shared. You mean from them to, oh. Got it. Oh, this is, okay.
Good idea. I would just make sure what, I'd find out what the transfer policies are for Peloton.
What is it? It's an internet session.
You sign up for monthly, and it's tied to your bike. Your bike.
Good afternoon, everyone, to the Tuesday, April 28th, 2020, Washington County Board of Commissioners work session. Since we have folks on the Zoom audio, I'll just note that we have a full complement of Washington County Commissioners. Commissioner Pam Treese, Commissioner Jerry Willey, Commissioner Roy Rogers, Commissioner Dick Scouten, and myself, Chair Catherine Harrington, along with many of our staff members. The first item on our agenda is board and leadership communication. Are there any items that board members wish to share?
I just have one, just briefly. I will be participating in a legislative a town hall regarding COVID, being sponsored or being organized by Representative Sherry Scouten. There'll be Tom Collette from the Beaverton Board and Lorraine Clarno from the Beaverton Chamber of Commerce to talk about the business and school perspectives.
Great. Anything else? Okay, I'll just mention that coordination meetings have continued, including with the tri-county chairs with regard to COVID-19. You may be aware that there were a few cities in, or a couple of mayors in Clackamas County that were talking about reopening prior to the governor's statewide lift, and they were the recipients of, or at least the mayor of Oregon City was the recipient of a letter from our Attorney General that notes that any reopening has to gain the approval of Governor Brown. So beyond that, in the days ahead, we're going to have the county administrators join us just to reinforce that we're working on a coordinated plan. And I know our administrator plans to bring our reopening plan and all of the different aspects of it, you know, public health, so on and so forth, to us in a future meeting. Beyond that, COVID tends to dominate our life these days. We do have an evening meeting this evening, and it will be our first on-camera Zoom meeting?
Yes, it will.
So, new.
Last week, but this one is fully promoted. So,
Okay, great. Are there any questions with regard to items that are on tonight's agenda? Commissioner
I,
Trees?
I have an issue, but I don't believe you asked for leadership updates.
You're right. Sorry about that. Skipped right over. Leadership communication.
Okay, just a few items. As you all probably realize or have seen, the budget is now available electronically yesterday and hard copy today. So we have our homework assignments. Oh, there it is. And
Special.
I think we've mentioned this before, but I just want
On my
to
desk.
point out that staff is working now to begin, once we got the governor's advice on meetings, or the governor's order on meetings, we're now rolling up our boards and commissions and CPOs again, getting those going so they can start meeting, which means you will start seeing appointments again on your agendas as we also bring those back. And as the chair mentioned, we're working on reopening plans. We're actually doing what we call an internal plan, which is for this organization, and an external plan, which is for the businesses and community. And we hope to have those to the board still in draft form in the very near future. And our call tomorrow should be very helpful in getting them coordinated, making sure we are going together. Because we expect ultimately the board will be the decision maker on putting those plans into motion once we get a signal from the governor. But we're trying to make sure we've got that all together and ready to go. And the last item I think you're aware, but I just wanted to mention again, is we have hired a new board clerk, and it's Kevin Moss, and he will be starting on the 4th, next Monday. And if you run into any of your colleagues from Clackamas County, head the other direction quickly, because he's coming to us from Clackamas County. So I already got harassed by the chair of Clackamas County over the hirings. I think the chair did as well. That's
Yep.
all I have.
Chair Bernard was ribbing us. He put us on notice. To our county council.
Nothing to report.
All righty. Our CEO of Clean Water Services.
Sure, just a quick report. So Clean Water Services continues to be in stable emergency operations. We call it our level 4 operations because we're on modified shifts and modified locations of reporting. The team's doing very well. They're working on the next phase so we can de-escalate to a level 3. And it's instituting things like self-monitoring programs, getting people comfortable with remembering where they've been and who their contacts are, and also the things we might need in the building to facilitate reopening. So the team's working on that right now. We also did receive formal notice of the National Science Foundation grant through Oregon State University to work on the research project that Dr. Ken Williamson is going to be conducting. So we're of a group of 5 very prestigious groups that got it. So he did a really nice job with the Oregon State University researchers. So they feel very, very good about the information they'll be contributing to utilizing our wastewater as a way to look at community health potentially for COVID.
Excellent. Thank you for pursuing that. And we'll look forward to hearing the results of this study and research. All right. Any questions on the formal agenda? Commissioner Treese?
I spoke with Mr. Rapelier this morning. I am going to recuse myself from the consent agenda due to a potential conflict on item 2D this evening.
Okay.
Can't we just remove that item and the commissioner can vote on everything other than that?
That is a possibility.
Yeah.
We talked about that as well, but I assume that either way would work for the commission, whatever's easiest.
All right, whatever you want to do.
I think we should just remove that item separately.
Great, thank you.
Yeah.
Appreciate it.
Yeah. We'll just move it under action item, modify the consent agenda.
I have one for, I have one other question. If I am to call in tonight, normally when you recuse yourself, you leave the room, correct? Am I correct about that?
That's optional for the commissioner to decide, as long as you don't participate. I mean, some jurisdictions do have the person leave the room. We typically have not had that happen, but it's up to the individual commissioners.
Okay.
Just be silent.
Just be silent and
I was considering if I were on Zoom tonight, how that would work. That's why I was asking the question.
I think you could just remain silent.
Thank you.
Okay. The mic picks up everything. All righty, that's it for the first item on the agenda. So we'll move on to the second item, which is our COVID-19 update.
Good afternoon, Chair Harrington and Board. I'm sort of, if I didn't know you all as well, I'd be having a little bit of a panic moment, but my notes are on here, and I can't get into any of my shared drive or into my quick, so I have no notes. I don't think you have it, it's just notes that so maybe if you want to move on to other things and I can keep trying to work on it. Sorry, I should have printed it out, and I usually do, but I didn't get back to my office to print, so I didn't have a printed copy. But
Is the government relations team on the phone? Oh, I know one of them is.
Chair, this is Paige. We are all three here.
Oh, terrific. Great. Well, would you mind swapping order right now and providing us with the legislative update? Okay,
Sure.
we got a thumbs up.
sorry, thanks, I'll
Terrific.
go work on getting that.
Well, don't
printed.
worry, we'll still be here. So take it away, team. We can see your bright, shining faces on our monitors.
Perfect. Well, good afternoon, Chair Harrington and commissioners and colleagues. For those of you listening in, I'm Paige Spence, one of our government relations managers, and I am joined by Aaron Doyle and Jagjit Nagra, the other government relations managers who will speak after I do. Elizabeth, our GR director, is not joining today because of a last-minute call with NACO and Treasury regarding CARES dollars. So to get us started, I'm going to ask Chuck to pull up a few slides. Hopefully that will work out technologically, although Kathy has been kind enough to print them for you as well, because our team just wanted to take a minute to let us all take a breath and review where we are in the political process related to COVID-19 response. Then your team is going to highlight a few items from the emergency board meeting of the state legislature last week. We're happy to take questions during any point in the discussion. Just try to raise your hand or say something since you're all very small on my screen. Chuck, are we able to pull up that quick PowerPoint?
I think
We're working on it right now.
Okay, cool. Thank you. I'll hang tight for a sec. I can't see everyone.
it was emailed to us as well. Does everyone have it on their device? Oh, here we go.
Okay, there we go. Great. Perfect. So this will be really quick. And Chuck, we can actually go ahead and go to the next slide. And I'm so sorry, I didn't realize that you'd have to do all the clicking for me. So I've got each bullet point coming up at once, but we'll go through them quickly. So if you want to pull up the first bullet, just wanted to give you guys first a few reminders of kind of where we've been so far. And then the next slide will be what we're expecting over the next month or so. So Chuck, if you want to go ahead and pull up those bullets, you don't have to keep track with me. That is just fine. So it's April 28th. So exactly 2 months ago, we had our first first case diagnosed in Washington County. And then it wasn't until 3.5 weeks later that the governor's stay-at-home order went into effect. And again, your team really appreciates the county's leadership in allowing us to telework and stay safe during all of this. Then Wednesday, March 28th to Tuesday, March 25th, This is when the state legislature held 4 hearings of a special joint bicameral bipartisan committee on coronavirus response that we sort of all anticipated and told you we anticipated would result in a special legislative session, which it clearly has not yet, but it did inform a lot of the e-board's actions that we'll be talking about in just a few minutes. March 27th, the CARES Act was signed into law, and then earlier this month, the Paycheck Protection Program opened. This past week, the e-board met, which is the special committee of the legislature that we'll talk about in a few minutes. Last Friday, we got our CARES Act funds, which is really exciting. And then on the same day, funding package sort of 3.5 went into effect, including notably and importantly, the $25 billion for testing and contact tracing. And then, as Steve Rhodes mentioned, yesterday, you guys received your budget proposal for this coming fiscal year. And Chuck, if we could advance to the next slide, please. Thank you. Chair, I don't know if you want to take a moment to mention your calls that are happening this Thursday with Senator Wyden and Congresswoman Bonamici more than what's on this bullet.
Well, we just wanted to highlight to our delegation members some additional funding needs that we have here in Oregon. We had expected, well, the Senate, I guess, will be convening next week. It looks like the House has made a change. I can't recall if that was just for this week or next week, but we're hopeful that federal legislation, particularly this Phase 4 stimulus package, will include funding for local jurisdictions as well as infrastructure needs as we move forward.
Great, thanks for that. And yes, so Chair Harrington is correct. We do have confirmation that the Senate will reconvene next Monday, so a week from yesterday. The House has not set any dates, but they have confirmed that they will not be in the Capitol next week, which is the advice of the House physician. But fortunately, a week from today, we'll be joined by Van Scoyoc on this Zoom call, which is our federal lobbying firm in DC. And so they'll be able to discuss the upcoming federal steps in more detail. And Elizabeth has been tracking the federal work particularly closely, the CARES Act and the dollars flowing to Washington County. The other thing that's happening next week, I don't have the exact date, but there's a medical committee that's public health experts and physicians that is sort of a subcommittee of the governor's coronavirus task force. And Chair Harrington and your government relations team were all on a call last week hosted by AOC with the governor and her chief of staff, where she outlined a sort of an overview of what that will likely look like. And you guys talked about that last week, but it's not been finalized yet. So we should expect to see more details soon. And then don't want to make any promises because we already told you that there would likely be a special session already. There hasn't been, so things are still in flux. And I know legislators are sharing their frustrations that they don't know exactly what's going to happen yet, but as you're all well aware, we're taking this all day by day. So Wednesday, May 20th is when we'll get the state revenue forecast. And we are definitely hearing that cuts are likely for the next fiscal year, but we'll have a much clearer picture when that comes out. And then those 3 days of starting on the 20th to that Friday is currently scheduled for legislative days. And things are happening on the regular legislative timeline. Agencies are still have been this month submitting their legislative concepts to the governor's office for an initial review regarding the 2021 legislative session. And normally in May, this is sort of when we'd start really be trying to begin to talk about the 2021 session, but it's very likely that those few days will be a special session and or focused more on coronavirus response. So that's all I have for just kind of that quick setting the stage of the timeline. And thank you, Chuck, for operating that PowerPoint. Are there any questions at this point before we move over to the e-board summary? Okay, I don't think I see any. Great. So then just a few highlights on the emergency board, which is a 20-member committee, and it is chaired by the presiding officers, which is the Senate president and the speaker, of course. They met last week, and our understanding is that the e-board has a reserve of at that date, about a $50 million reserve, and the presiding officers decided to allocate about 30 million of that, or exactly 30 million of that. And so I will take on a couple of the housing and healthcare components that were included in that, and then I will stop talking and turn it over to Aaron and Jagdeep. So out of the 30 million that the e-board allocated, we were really thrilled to see that over a third of that, 12 million, went to housing. I know that legislators and this body has been hearing from constituents about financial insecurities and job loss, and the unemployment numbers are just staggering. So we're thrilled that there is $12 million flowing both for rent assistance, which is going to be $8.5 million. That money has been allocated to community action agencies, including Washington County, who will be able to provide rent assistance dollars directly to the landlords in lieu of payments that folks haven't been able to make. And they're prioritizing folks that are at 50% or less of area median income for that. And then the remaining $3.5 million out of that 12 million is focused on hotel and motel vouchers for folks who are symptomatic or have been diagnosed with COVID-19. And that's, of course, mostly our homeless population, but also we are really glad to see that those dollars can be used for farm workers as well. I know Marty and I and Tricia have been talking a lot about the influx of migrant farm workers that will be in Washington County, and wanting to make sure that that population is safe as well. There are some gaps still in the rent assistance that we will want to be just mindful of going forward, and that your team will be focused on. So we've got legislators who are saying that they've got a lot of middle income constituents who have never, tried to access safety net benefits before, who are now for the first time exploring SNAP benefits, going to the food bank, and are worried about rent assistance. But they're worried they won't qualify for some of these safety net services because of their historic income. But still, some of these folks don't have savings and are considered vulnerable. So that's something that we're looking at for sort of the next round of focusing on rent assistance. Continuing with housing, it's a separate bucket of money. There was another $2 million allocation that is emergency short-term housing, which again would be these hotel and motel vouchers for victims of domestic and sexual violence. I know we've all been concerned about some of the calls that our sheriff's office has been getting around domestic violence picking up during this very stressful time. So that is also included at $2 million statewide. And then switching over to healthcare just for a second, there's two issues I wanted to bring to your attention. One is that another great investment that the e-board made is just shy of $3.5 million to keep those in long-term care facilities safe and protected. And so the funding is encouraging proactive testing for the frontline workers at the long-term care facilities, confirming symptoms, validating negative tests, assisting in contact tracing. And this is really important because the New York Times has identified at least 7,000 coronavirus deaths nationwide from long-term care facilities, which is about a fifth of total deaths of the country as of the time of that reporting. So those numbers are old, but we know that this population is elderly and vulnerable, and want to make sure that both of the workers and the residents are safe. So that funding was important. And then finally, and the reason I wanted to flag this issue is because this, out of the 11 items that the e-board took on, this is the only one that was tabled, if I remember correctly, where they didn't take a vote. So they voted on these 11. Aaron is nodding yes, I'm correct about that memory. So there were 11 agenda items that the e-board took on. The only one that they declined to vote out was a loan program for hospitals, particularly for small rural hospitals who have been really struggling with the absence of elective surgeries and some of those normal procedures that keep them operational. And part of the discussion around tabling this agenda item was that there were some concerns around that this should be grants, not loans, because elected officials in those districts were concerned that the hospitals wouldn't be able to repay those loans. And then also that the loan application process as it was set up, and there were still several questions around exactly how it would work, might be burdensome and out of the capacity that some of the smaller facilities have that don't have technical staff to work on these loans. So that's what I have for now, and I'll update you, of course, if the e-board does meet again around this hospital issue. And mostly wanted to flag it to let you know that if the e-board does meet again, it may not be for issues that are really pertinent to our organization. Any questions or comments there? I can't quite see you, but if not, then I'll turn it over to Aaron and Jagjeet. Yes, Chair.
I have a question. So for the aspects that, Paige, you have covered around the rent assistance, the vouchers, I'm wondering what, excuse me, what model the state is planning on using for disbursement. Will it be a proactive disbursement, or will it be that local communities need to invest those dollars and then submit for reimbursement?
Thanks, Chair. That's a great question. So the rent assistance dollars, as I mentioned, are flowing through community action agencies, and there's nothing that our community action agency needs to do to apply. The state is allocating these dollars to the housing agency, who already has the contacts with community action agencies and also contracts, actually, excuse me, is what I meant, funding agreements. And they're using the same formulas that they use for other programs like EHA and SHAP, which are emergency housing programs that operate normally. So that infrastructure and process is already in place, and they'll be using that same funding formula, which is, you know, a set of factors such as area median income, number of folks under the poverty line, population, et cetera. So we expect that those dollars are going to flow soon and according to that usual formula. I hope that answers your question.
Okay. Commissioner Willie has a question.
Yes, and following along the same lines, only for the $2 million that's for designated for domestic violence, how would our own Family Justice Center here in Washington County be able to access some of those funds, or at least apply? So how's that money going to be distributed out?
That's a good question. And there's still some agency guidance that needs to be put out about that one. I'm going to follow up with you. My understanding is that it's a two-part formula that includes a base amount per jurisdiction plus a pro rata formula based on county population. But in terms of the application process or anything like that, let me do some research and get back to you if that's all right.
Okay, thank you.
Sure. And with that, I will turn it over to my colleagues.
Who's next?
And that would be me. Good afternoon, Board. Erin Doyle, one of your government relations managers. I'm just going to talk really quickly about one of the 11 items and then say a sentence on a second. The other big package that I think will be important for us, especially for our small business and the small business work we've been doing, is the e-board provided $5 million in general funds to Business Oregon, which will be partnered up with $5 million in lottery funds that Business Oregon already had to do small business assistance programs. Like us, the state is recommending using the CDFIs available in the state to provide to spread that money out. But there is some talk about reserving some of those dollars for one-to-one leveraging of local business assistance funds. However, we have no idea exactly what that looks like. I'll be reaching out to my colleagues at Business Oregon to find out what they plan to do with those, how they plan to leverage, how much can we access it based on our past investments and all of those questions which don't have an answer yet. They're focusing those dollars specifically on those small businesses that have 25 or fewer employees that did not receive assistance through through federal sources, either the Paycheck Protection Act or other CARES funding. So that is good news that hopefully we'll be able to leverage more dollars so that we can extend what Washington County's done already, if we can, through the work that work group has been doing. The other thing I'll mention just very briefly is there was some push out of money that had been set aside related to wildfire insurance and activity, just so that we're prepared, because we are sadly about to walk into another dangerous season of wildfire season. And because the 2020 legislature did not do what it needed to do, the e-board had to act to set those dollars aside. While we don't think that there will be a wildfire in Washington County, we do have forests. So it's good that those dollars are available, but is of minimal impact to us more than likely. I will answer any questions and then turn it over to Jagjeet, and he can talk about the CARES and his portfolio. Looks like I'm thorough or boring.
Okay, good afternoon, Board. This is Jagjeet Nagar, Government Relations Manager. I'm going to be quite brief as well. I'm going to focus on two of the areas from the e-board that have a bit of a tangential connection to the county, but I wanted you to at least be apprised of it. The first one is a $10 million Oregon Worker Relief Fund. This is being coined, and what this is basically these are monies that were sent to the Oregon Community Foundation to create a grant program that would specifically provide unemployment monies to those who aren't able to qualify for unemployment dollars due to their immigration status. And so, as we mentioned earlier, we will be having an influx of migrant workers. And so this is this resource I'm hoping that we can help our community-based organizations share with their constituents and their folks who could be utilizing this. Additionally, it may be a resource that we want to share with our own constituents to be able to direct them to this resource. And so I think this is something that we can certainly highlight. In terms of the actual processes, it seems to me that the Oregon Community Foundation will be working with local culturally based and community-based organizations to dole out the grant money. So that is something to definitely keep an eye on. And the other area I just wanted to briefly mention was that there was about $3.8 million given to the Public Defense Services Commission. And you're probably wondering, why is JG talking about public defense services? Well, that's, again, a part of our judicial ecosystem, if you will, right? So access to public defense services. And so, my thinking when I see something like this is that this is an opportunity to say, look, if we're funding this, and Washington County has had, has been understaffed in terms of their judicial staffing for quite some time. Let's also be mindful of our local courts and staffing and resources, especially considering the amount of strain that COVID has put on our resources, in addition to even the new ruling that came from the Supreme Court of Oregon with the unanimous rule. And so we're going to probably be seeing, I was talking to Kevin Barton this morning about how there's likely going to be an uptake of appeals cases and other cases coming back their way, even 20, 30 years old up to, that will take time and resources. And so this is, I think, another opportunity for us to be able to work with our legislators to say, look, we need money for the good work that we do as well. So those are the two updates I wanted to share with you. I think that the memo that we sent is a little bit more substantive, and as always open to questions and answers.
Are there any questions? Excellent memo. I really appreciated it. I think it was very comprehensive and very clear. So, and I think one indication is we had so few questions. So keep up the good work. We're very well represented and very much appreciate all of the information that you digest on our behalf, as well as representation for the county. So onward, ho we go. Stay healthy.
Thank you, Chair.
Thank you.
Take care. All righty. So we'll move to agenda item 2, COVID-19 update.
Good afternoon, Chair and board members. Thanks for your flexibility, and thanks to the GR team for jumping in. As usual, I had to just go and reboot, and then everything magically appeared again. But so just a quick update today. I don't have a ton, but it's nice to touch base. So we'll start with the numbers as usual. So cumulative number of positives since February 28th was 475. And you may note that that number didn't go up very much. And some of it is because we learned that 2 of the cases actually belong to a new county. Sometimes that happens where people are reported in one county, and when we do the interview, we realize they really live in a different county. And that happens. So we have had 11 deaths and 109 people that have been hospitalized. And the new data dashboard really has a nice feature in there so that you can see the average number that's hospitalized in the state each day. So it's kind of a nice, you can hover over and see the number for that day, and it is going in the right direction. So we've had just 7,720 people who have been tested in Washington County since February. So a couple of data updates. You'll be seeing some new data pretty quickly. So the Tri-County area and the state are planning to release data by zip code beginning within the next week. So you'll see that change. And then I think I've met with each of you now. We do have a press event planned for tomorrow, April 29th, announcing a large disparity in our of positive cases within the Latinx community in Washington County. So we'll be doing that press release tomorrow. So some of the efforts that we're continuing to work on around diversity and equity are supporting our communities of color. So a couple of things that are in the works. One is we are meeting with the Coalition of Communities of Color and the CEOs of our community-based organizations tomorrow ahead of the press release, because like you, we don't want them to be surprised by the data or what we're saying about the data. They're not going to be surprised by the data, but we just want to make sure that they're aware that the press release is happening and what we're going to be saying. In addition, the first week in May, Chair Harrington has agreed to host a virtual forum with our community-based CEOs in Washington County. And that's just an opportunity for us to hear from them how they're doing, how their organizations are doing, if they're struggling to meet their missions, to provide services to community members. Just an opportunity for them to see Washington County leadership listening to them and learning from them and raising any issues that they would like to see us raise to a policy level. It's also an opportunity for us to talk about some new opportunities. For example, as we move forward with hiring people to do contact tracing, we're hoping to partner with them to help find the people, potentially for some of their employees who need work to participate in that, help us to reach community members that they work with who may have recently been laid off and have matched skills. And then also just to help with ongoing education and outreach. And when I say partner and help us, we are talking about making sure that there's contracts and that we're valuing their assistance with our funding sources. So that's happening in the next couple of weeks. Just wanted to give you a heads up. So let's talk about what's on everybody's mind. Opening Oregon, opening Washington County. And as a reminder, and I'll do this in the public setting tonight, opening Oregon is at the direction of the governor. And so we are working and planning, working with the governor's office, with OHA, with our partners within the county, and doing lots of planning, as Stephen said, both at with an external focus at the EOC, as well as an employer ourselves as Washington County. But what are we looking for? So it's those gates. And the first gate that we need to pass through is we need to have 2 weeks of declining cases, hospitalizations, and IC level care. And again, the good news is if you go in and look at our tri-county data and really the statewide data, we are headed in the right direction. And so that's really good news. We're working towards that. The other is there's really 3 criteria that I'm going to talk about, one of which we have the most control over. So the first criteria is we need increased testing availability. And there's going to be an emphasis really on testing populations, continue to be populations at severest risk of disease, the healthcare providers, those that work or live in a congregate setting. So those are the assisted living centers, adult foster care homes, jails, so any kind of congregate setting. It's being expanded to also be congregate settings for daycare services, so childcare centers or daycare centers that are still operating. So there is a lot happening around increased testing capacity. Oregon Health Authority has contracted with 2 large national laboratories, Quest and LabCorp. They have received test kits through Health and Human Services at the national level. They've received test kits, and they're beginning to distribute those to the county. So, for example, Washington County received an allocation of 400 test kits. So right now, we're not being bombarded with, we need test kits. And so we're taking a little bit of time to really think about how do we distribute those to the most need. So is it, Virginia Garcia Neighborhood Health Center? Is it our assisted living centers? And so we're going through a process to make sure that we're distributing those so that we get the most people tested who need to be tested. OHA has expanded its guidelines for testing, and it is allowing for testing for non-symptomatic if testing capacity is available. So we always have those ifs still. But people that are not symptomatic that work in those congregate settings that I just mentioned, so like childcare settings, assisted living settings, group homes, those kind of things. They are also emphasizing, continue to emphasize people who have symptoms should be tested. Workers who provide direct care should be tested. People that are essential frontline service workers, so those are people like grocery stores, pharmacy, food service, transportation industry, are also prioritized for testing. All of this is, of course, so they expand their guidelines, which frees up healthcare providers to expand testing, but it's still based on availability of testing, and each system is slightly different, but it's the first step and is expanding the guidelines at the state level, saying more people can and should be tested.
Can I ask a question on that? Because I want to make sure I heard this right, that the OHA has expanded the guidelines to include people who are exhibiting symptoms. It seemed like before it was just the most severe cases that were being tested because, as I understood, or you taught me, that if you have mild symptoms, knowing that you have the virus as verified by a test isn't going to change your course of treatment. But it now sounds like anyone who has symptoms, as long as the test kit is available, you can get. Do you still have to go through your doctor?
Yes, so these are the guidelines and recommendations for healthcare providers. So it's saying when you have a person that calls you, so yes, at this point, it doesn't mean that it's not happening, because the drive-through testing that's been available is largely private sector in our healthcare systems, and there's nothing that tells them that they have to notify us that they're doing it. They don't have to tell us who's eligible or who they're testing. So I can't say that nobody can get tested if you're asymptomatic, but the guidance to healthcare providers includes people who have symptoms. And now they're including people who are essential frontline service. So there's an emphasis on folks who are essential workers. And then they are also prioritizing communities of color because of the disproportionate impact in those communities.
Go back to the very beginning. You talked about that one of the first indices for starting to release some of the restrictions is that there's a declining rate of hospitalization and cases. You say we're going in the right direction. Does that mean we're climbing less quickly? We're actually declining? I mean, what does that really mean in terms of how close are we to that parameter?
I think that if the current trajectory and trend holds out, we're very close to meeting the numbers gate. And that's just one of the gates. So we had a blip earlier this week, and in my head, it's probably related to beautiful sunny weather and Easter. And so it's an opportunity that we're really saying we really need to hold strong and continue to stay home to save lives and to keep our numbers going in the right direction so that we can very thoughtfully and safely start to reopen. So that's the testing, and it also is increased access to antibody testing. There's been a little bit less emphasis on that, and I think part of it is because there's a lot of tests out there that aren't reliable, and so we need reliable, valid antibody testing. The other thing, and this is where we have a lot more influence and control, is improved contact tracing and systems in place for isolation and quarantine. So what that means is that we locally need to be able to identify those cases quickly and early, and we need to interview those cases and figure out who they've been in contact with, and we need to contact those people, ask them questions, and monitor them for symptoms. And there was a national study that showed for Washington County to do this over time, we need about 180 staff to accomplish those roles. And what I want to say about that is that we did ramp up during this. We have about 10 staff that typically do this kind of work, but they typically were doing this for tuberculosis, salmonella, shigella, gonorrhea, syphilis, and those things haven't gone away. And so, and in addition to the 10 people that were doing it for our normal communicable disease, reportable conditions, we pulled in other people from different areas of health and human services, and we were able to ramp up to about 40 staff that are currently doing this type of work. And so what I guess the reason I'm saying that is it's not like we're at zero, and that if our numbers and everything else were in place, that would be the holdup to opening. We would be able to do the identification and the isolation and the quarantine, but as the numbers grow, or in order to do it quickly enough and really to sort of squash things early, we're going to need over time to grow that workforce. But we do have the beginning of that workforce, and we have plans, and we think we'll have firm plans within the next 2 weeks, working with OHA about what that staff needs to look like, how they're going to get trained and supported. And remember, it's all the staff, but it's also all the support that they need. They'll need laptops. They're going to need phones and technology, and so it's all of that goes with it, including training. So then the third piece is, again, something that we don't have a lot of control over as the local governmental entity, but that's adequate health system capacity, including adequate PPE. And looking at the data, it looks really good. We have definitely adequate health system capacity at this point. We have enough hospital beds, we have enough ICU beds, ventilators, and at this point, adequate PPE. So it's some assurance that that would sustain over time. So as these criteria are met, we can begin reopening, and both the White House plan and the governor's plan basically has 3 phases. And I'm going to be really brief about these because there are more questions than answers at this point. Phase 1, and this is sort of phases according to Marnie, phase 1 is really pretty close to the current situation. There are some loosening of some of the restrictions, like allowing small gatherings, but small gatherings while we're maintaining physical distancing and we're continuing to use our face coverings. We would continue to encourage staff to telecommute, and we would definitely continue to encourage those that are at greatest risk over 65 with concurrent medical conditions that they need to continue to stay home. Phase 2 is a little bit further lifting of the restrictions. However, we're still going to be telling people that are at highest risk of severe illness to stay home. So those same messages will continue. I think that you're going to really want to think about fashion in your face coverings, because I know you're matching. It's nice, I know. But I think that
doesn't
face
happen every
coverings
day.
are really going to become part of our new normal. And what I'm calling phase 3, because that's where there is the least information right now and the least specificity, I'm calling phase 3 is going to become our new normal. It doesn't mean that there's going to be a light switch and we're going to have large gatherings like our fairs or large concerts or sporting events. I think those will happen over time, but it is going to take some time to really move from where we are now cautiously. And all that time, we're going to be really monitoring what's happening. Are the cases continuing to go down? And being prepared in case we need to go backwards a few steps. So that's my information for today, and you'll probably hear much of the same this evening on camera. But I'm open to any questions.
Commissioner Willie?
Yes, we were, over this past week, we've watched a fairly long email chain from a variety of counties through the AOC, basically trying to go a little bit rogue, which I thought was interesting since the governors did the same thing to the president. But is it going to be kind of one size fits all for the entire state, or do you think the governor's going to have a faster relaxation process for some of the more remote counties, maybe some of the coastal counties?
So what I can say is that she has a lot of different work groups that she's pulling together, and some of them are the more rural counties are less affected. I think that she's trying to pull together experts and really look at the data and make some good decisions. And it's really tough because people are really suffering. Our businesses and our community members, and so I think she is really trying to balance that. I think in the metro area, from the public health perspective, we're trying to at least stay aligned and communicate and cooperating. That doesn't mean we're all going to do exactly the same thing at the same time, but at least if we're going to do something different in Washington County, then we want them to know that that's our plan. I don't know exactly what the governor's going to do. I wouldn't be horribly surprised if there's not some allowances for the local data and the local needs. It's kind of the Oregon way. You may have heard more, or Steve from AOC, but right now it's kind of confusing.
One resource that I posted on my work Facebook page is a map that shows the different counties and the number of reported cases and the number of deaths. And I found it really helpful because it showed me at a glance view which counties for that particular day, I think it was the 24th, had no cases reported and no deaths. And I think Baker County is one of those. And I think Baker County was the first county to submit plans for approval. So lucky them. I think for the rest of us, we have to continue to work through the process just like they did, but our circumstances are a little bit different. And we'll get there. You also remarked about the coastal counties. Well, each one of them is a little bit different. Last evening, the Lincoln County Commission voted to continue their short-term rental closure program through the last day of May. So that would include the Memorial Day weekend. So folks who were counting on a hotel or a short-term rental will find that they're not able to do that. And I believe that that is related to the fact that they need to ensure that they continue to have the hospital capacity for the most vulnerable members of their community. So it is something we're all trying to work through. We'll have the opportunity to learn more about the risks involved, because I don't think anyone can guarantee any reopening without there being some risk. So we'll just manage the best through it that we can. So I know, thinking about all the parents, doesn't matter what age your child is, you know, from preschool to college, right? People are struggling to have access to materials, and our own library system here in Washington County has done a phenomenal job of adjusting programming. But I know that there are folks who would really like to return materials and get new materials, and I'm hopeful that we'll be able to get to that soon enough here in a manner that is safe for the employees, but also for our community members.
And I think that on the human behavior side, we are, you know, really approaching that sort of tipping point. People are really tired of COVID and tired of being told that they can't socialize the way that they're used to it. And we are seeing more people out and about and getting more complaints about gatherings, and working hard to get people to, you know, stay strong because things are headed in the right direction. But we really need to have a planful approach to opening back up. But part of that plan is not letting people get ahead of us and getting so frustrated that there's sort of, you know, mutiny in our communities.
I know I have appreciated the reinforcing messages that our efforts to date at staying home and this, you know, this limited travel and access has really made a difference. We have collectively saved lives, and we're being asked to be patient just a little bit longer. And the month of May is right on our doorstep. And I'm feeling really good that if we continue to adjust and manage things well, that as we look beyond May, that we'll be able to do a little bit more than we've been able to do. But that's my optimistic crystal ball that I'm looking at.
Well, I think the more information that we can put out there in more of a roadmap. So if we say, we think by the time we get to May 15, we might be able to do this, and May 30, we might be able to do this, and I think it helps us say, okay, I can get this out for 2 more weeks, and we'll see how this works. And then still emphasizing the importance of still our social distancing is going to be a part of the new normal, and maybe masks for a considerable long time, and begin to, I think, communicate that kind of messaging that it's not a light switch. We're not going to turn it on and go back to what we were in last December. This is the new normal, and we need to be able, I think, continue to create that picture of what that new normal looks like as we roll in to reopening the business sector.
I don't know about you, but I'm finding that some of these behavior modifications are feeling more second nature to me now. You know, the moment that I leave my office, I have the mask on. When I return back to the office, I sanitize my hands again, you know, trying to minimize the touching of other surfaces. And it's taken a few weeks of practice, but it's part of the everyday routine now. And I'm sure that there are more that I'll learn in the coming weeks of the month of May.
One comment that I'd make, I agree with what Commissioner Willie is saying in terms of trying to be very empathetic. There are folks out there, and maybe it's just who I'm hearing from, but they don't have the luxury of waiting a whole long time. And the stimulus bills, if we want to call it that, 1 and 2, are certainly not paying the bills. They're really not. And so they're angry about the new corporate activity tax. They're angry about local government, and we, I think, are trying to do our best to understand that we have to practice these things or it's going to get worse. We all are sympathetic. So empathy, I think, is the right word to use at this point. But I want to congratulate you and your staff. I think that you've certainly been loud and clear about you want to open it up. We all want to open up. We want to safely do it. It's just a matter of time. But I'm hoping that we can find some happy medium of, though it's not a light switch, maybe there's a dial, as the governor of Washington says, and maybe we can find that we can open up some of our restaurants with limited seating. Maybe we can open up our theaters with limited seating. Maybe we can do some other things. And I've not heard our board say that's not what their desire is as well, and nor your staff. So thank you for the hard work. It's I do want to agree that there's a mood out there that's not exactly very pretty right now, and I can understand why.
Yeah, and I think along with that, Roy, it's going to be important that in our business task force, we've talked about providing some guidelines for reentry, because you take those restaurants and things that have been closed now for a month, you just don't, again, walk in the front door and turn on the light switch and say, okay, we're open for business. There's going to be considerable of advanced work, and certainly reconsideration of social distancing between those tables, and so lots of thought process. And I think it's incumbent on us at the county to be trying to be put together some sort of messaging that says these are maybe some of the new guidelines that we're going to be looking at when we do open the doors, and let us help you provide those, either help you with the guidelines, and maybe on a best case scenario provide a little bit of funding. Because you're going to need to probably go through and sanitize your business facility, and that's going to be take some additional costs to open those doors. And here you've gone for a month or 6 weeks without any revenues. So where's that going to come from? So anyway, just all of that. We've thought about what does this really look like? And I think to follow your point, Chair, is that to keep them incentivized and encouraged that at least there's a little bit of a light at the end of the tunnel here that we can continue to point to and help them get there.
Yep. Thank you.
Any other part of the organization for COVID-19 update? Nope. Okay, great. Well, thank you, and please don't hesitate to this evening when we're on camera to cover as many of the bases as you think are helpful for our community. You've done a great job with us. Thank you. All right, we'll move on to the next item on our work session agenda. Jack Liang, if you could join us with regard to the Budget Committee member recruitment, midterm vacancy.
Yes, good afternoon, Chair Harrington. Good afternoon, Commissioners. As you recall, at last week's board meeting, you appointed Budget Committee members to the Budget Committee to fill vacancies. And actually, shortly after the new appointment, I have received a midterm resignation due to scheduling conflicts to this year's Budget Committee meeting. And Leroy Bentley has resigned from the Budget Committee, which leaves us with one midterm vacancy on the county's main Budget Committee. And I have reviewed that we do have other applicants that is in the queue, ready to fill that seat. And I actually recommend Jennifer Burkhardt, who is a City of Portland employee, a new resident in the area, has budget experiences of people of color, who may actually be a very good candidate for the Budget Committee for this year. So, and I'd be happy to answer any questions for this recommendation.
Just two quick things, one humorous and one not. The humorous one, we keep stealing people from Portland. Are they getting a little unhappy with us, Jack?
I can't speak for their attitude on that. So
Beauty of choice.
Yeah. But in regard to Leroy, he's really served a long time and very admirably. Do we know why he resigned, or is that not public?
Yeah, so what he explained is the scheduling conflict to the meeting date and time that we have set out for this year. So it just doesn't work for him. Yeah.
Thank him for his service. He's done a great job over several years.
Yeah.
Yeah, wasn't he on a couple? He's on a couple of budget committees, wasn't he?
So last year he was on the main committee as well as the ESPD, URMD committee.
Right.
And this year, because we have a lot of applicants, so we reappointed. You reappointed him to the main committee, and then we didn't appoint him to the ESPD or the URMD committee this year. So he's on one this year.
Yeah, he's got a lot of years of service. We probably need to recognize that in some form or fashion with a letter or something saying thanks for your time.
Okay. Well, definitely send something with a thank you card on that. Yeah. Is there any other questions for this appointment or recommendation? Okay, I'll come back to your board meeting next week with agenda item and then for the appointment of this vacant seat on the budget committee. Thank you very much.
We'll move on to the next item, General Fund Reserve Assumptions Overview.
And good afternoon, Chair and Commissioners. I am here again. And I'm here to provide additional information. So we provided a financial update to you 2 weeks ago, and you had actually a follow-up question about what was some of the differences between the latest financial update in terms of general fund reserve projection versus what was last presented actually was back in February 2020. Not too long ago, but we actually had a lot of information. A lot of things has happened, and also a lot of the county operations has changed during that time. So I prepared this handout that hopefully you all have in front of you that compared the February projection versus the April projection, and quite a few things in there are different. What's same in there is actually the property tax. We're still projecting 4.5% growth rate for fiscal year 2021, and that is an area where we still feel that although that the local economy is taking a toll in many areas right now, we're not anticipating a huge, a sharp AB change just yet. Whether for the years that's going out, we definitely have looked at some of those numbers. And the transient lodging tax annual growth, we definitely changed that number back quite a bit. We were on a 6% projection, which was fairly conservative looking at the historical trends. We were on double-digit growth for a number of years. It was on a decline, but still growing at a pretty fast pace. And given this COVID-19 situation, we have bring that projected percentage back to 2% next year. And we're definitely monitoring to see if that is even realistic going into next year, depending on the reopening plan. For the revenue collection rate, we had 100% budgeted in the past, and that has been supported by track record. Yes, ma'am.
I just want to make sure that the figure that's next to the percentage, so in the February column, it says 6% with 4.7 million, and in the April column, it takes it down to 2%.
Correct.
Yet we're still at 4.5 million, so
correct.
Still pretty healthy dollar-wise.
Right. It's the 2% is really on the growth of 100%. So we're comparing 106% for next year versus 102%
okay.
next year. So
Right.
you wouldn't see a big dollar difference there.
Okay.
And this dollars are, that's a great clarification question. These are dollars for the entire revenue that we expect for general fund purpose.
So it's just the growth percentage compared to last year.
Correct.
Thank you.
Yep. And on the revenue collection rate, we have always assumed 100%, and in our past record, we actually does pretty well with that, at least for the last 10 years with the economic growth. For next year, we are actually putting in 98% just to be conservative, anticipating some revenue shortfalls that we may not collect as much as we do. You can see, I'd like to point out, this is actually the single biggest item that's affecting next year in terms of dollar amount, and we're talking about nearly $6 million altogether as far as difference goes. And then onto the expenditure section, there's a COLA. We have a projected 2.5% before February, and then in the end of toward the end, we are actually landing on 2.6%. And we go with a CPI index that has a very set formula, very set publication, so that's where we ended. And the difference there is really merely $91,000, so not too much. FTE and personnel annual increase, we started with a 1.5%, if you recall, in our previous financial projections. And then what we ended up in April 2020, along with the request and the proposed budget that is ready for your review, we ended with 1.2% growth in this year's budget. So that equates to about $250,000 in terms of cost. Material and services, we were anticipating a 3% increase going forward. That was riding on a very healthy economic expansion scenario still. But ever since COVID-19 happened, our risk for at least temporary economic impact has increased. So we have brought that back down to a 0% direction, and then end up with a 0.25% actual growth in this year's. Expenditure reductions, we wasn't planning on any of the expenditure reductions, so we were counting on $293 million general fund expenditure. And then this year, we actually implemented 1% scaling back from the requested budget on that. That brought us back to $290 million, and then that created actually nearly $3 million worth of difference in our budget. Expenditure spend rate, we have always assumed 94% overall spend rate. What that equates to, looking at our track record, it includes 94% personnel services. And for the M&S, we actually have a track record of close to 90%. And for the others, meaning all the transfers, debt service, all of those that doesn't have room, we always spend 100%. And those always average out to be about 94%, and we're assuming the same assumption for next fiscal year. So with all of that, you can see that in the second page of the handout, I included the chart that was presented to you in the financial update number 2, which was back in February 2019. Fairly healthy. We're seeing a little bit dipping into the below 15% range, but that's really far in the out years. And then with all of the assumption changes on the third page over here, that is our newest chart. Based on all of the assumptions that's feeding into the latest projection, we're actually seeing to dip into the below 15%, possibly in fiscal year 21-22. Of course, the county will continue to monitor all of the financial performance and then try to come up with strategies to prevent that from happening, or even doing some of that just to help the economy, to help to grow. So, but CEO is definitely monitoring that on an active basis to set the county up for the future financial success. So that's the difference there. I'd like to point out that this chart is a little bit different from the last presentation that you received. It's because that we actually updated some of the assumptions on the expenditure spend rate in there to bring it more to a realistic level. So I'd be happy to answer any of your questions.
I don't have any. Thank you. Anyone else?
I was looking at, actually looking at the budget that you sent to us, the proposed budget that you sent to us last night, and I was looking at it on this little dinky document here, which very hard to see, 379 pages on it on a telephone screen, so I wasn't doing that. But I was looking at the staffing, new staff positions that you were projecting, and I can't remember what those numbers were. And I was also looking at, it looked to me like a $64 million reduction in special fund budgeting. Was I seeing those numbers correctly?
Let me get to the page that you're referring to. So looking at our total budget, there's a $64 plus million reduction combining the capital and the non-operating funds.
Right.
So a great deal of that is a lot of the capital projects are actually heading toward the tail end, and then the new ones haven't really ramped up yet. Mm-hmm. So if it's not necessarily special operating fund, it's actually a lot of the capital funds and the non-operating funds.
And the number of staff positions, I've heard, I can't remember the numbers, if it was 15 new positions or if it was less than that. I think, doesn't this budget say 15 new positions?
15 new positions without other funding sources. So we actually ended up with a 19.37 for general fund, and a good portion of that we actually had a grant fund, a new grant fund that's coming in to support. Some of that is in HHS, and then some of that is actually also there's just other funding sources. Some of them are offset by like contracted services that was contracted out before. So the true new position that was added, if I recall correctly, there's that 5 DEI position plus a director of support services position plus the economic development position and the CAO's staff support position. So that's 8 altogether for general fund.
Right. Okay. All right. Thank you.
8.5, yes.
Procedurally, we have the proposed budget, and we have budget committee set up in the coming weeks in May. We have funding that is flowing from the federal government as part of this COVID-19 cost and economic stimulus. So it in some ways feels like a revenue moving target in a way. So I'm anticipating that as we go through the process, there will be several technical adjustments in order to document the receipt of that revenue. And then after we adopt a budget, depending upon how things flow through the federal government and the state government, that we'll have to make some further supplemental budget adoption in order to go through the necessary steps for the budget. Does that sound about right?
Yes, that's been our discussions of how to approach it, is move forward with the document we have, understanding the condition, knowing that we're going to have to come back and visit it. And that actually allows us to have a lot more information in front of us when we start to make those adjustments.
Yep. A much better problem to have.
We hope.
Yes, to realize those revenues and invest in community needs, so.
Absolutely. And
So speaking of the budget process and everything, and realizing that the CARES money of $104 million came in, is that going to be in a different fund? So because we have to do the reporting back to the federal government, and it only covers certain costs. I read the document of what you can reimburse yourself for versus what you cannot. Are we putting that in a little different bank account so we can adequately track all that money?
Yep, absolutely. We are putting in a separate bank account, and we would come back to your board to authorize a new special fund to specifically track this funding source, just because of the size and like how specific it is actually. So it will be in a separate fund as well as a separate account. Yes.
So do we have any idea right now how much money we have spent? I mean, we probably do. How much money we spent so far that is potentially reimbursable out of that $104 million?
So we have collected some information related with the AOC survey, and I can't speak for sure if all of that fits the requirement for the 104, but we are, if I recall correctly, just off the top of my head, we're right between 5 to 6 million in terms of both cost and revenue losses. Of that, there's about 3.5 in terms of revenue losses. So we're looking at about 2 to 3 million in terms of cost of personnel cost and material and services. But again, this is off the top of my head. I'd be happy to forward that information.
I won't hold you accountable for that specificity there. I was just wondering that's a big number, $104 million, and so I was assuming we hadn't spent $30 million so far out of our own pocket. So
no, not yet. Yeah, we're far from that.
All right.
Yes.
Well, I think I also recall that, it wasn't HUD, I think it was our Health and Human Services organization received a grant, I think, from National Health and Human Services to do some of the COVID testing. So
Yes.
that does not need to be verified here today, but it might be helpful in future weeks for us to have a better handle on, gee, what are these different funding streams and how do we just get our heads around it? We don't need to do all the cost accounting that I know all of you do. Just generally, it may be helpful.
We recognized that also, that we had funds coming from all different places. So we've created the EOC as our central collection point, and they're designing a matrix for us that will show that. Because we need to understand all those different sources and how we relate to them. And interestingly, we found that FEMA, may know, only reimburses 75% of our costs. And so now floating in our mind is, well, we've got the CARES Act. If they're allowable under that, we could probably pick up 75% from FEMA and 25% from the CARES Act. So that would actually extend our CARES Act dollars to other things, if we can do that. But those are the things that we're just starting to work on. Because you've all seen the work group that we've now stood up to work on how we allocate the CARES Act money. We're working with staff right now to try to get a projection of what we think our cost internally will be until December, the end of the calendar year, which is the end of the CARES Act funding, so that we can go forward with that, set that amount aside plus a contingency for it, so that we can set that aside and then look at what the remainder is and then start the discussion about what we do with the remainder, how we allocate it. And that's examining what the Treasury guidance allows us to do also.
All right.
Any other questions? Oh, Commissioner Treese?
Quick question, how is that money determined? Is it based on a per capita basis for the county? And if so, do we have a responsibility to the cities for part of that money?
There's a formula that includes population, but everything we've seen makes it clear that it is not intended to be a pass-through to the cities.
Okay.
And in fact, the money that the state received in the CARES Act, we think, was intended to be shared with the cities. But there's still a lot of discussion, arguments, whatever going on around that. So I don't want to say we know a definitive answer to it. And there is, of course, work you heard our GR folks say, there's work going on in a subsequent, if you want to call it CARES Act, that may actually clearly direct funds to the cities that weren't included in this act. So,
And that would be the Multnomah County situation with the city.
Multnomah County
That's
and the
the-
city of Portland have received funding as well.
no, it would be different. This time, I think the counties would not be funded, and it
Right.
would be direct to the cities, yes.
Thank you.
I think we also need to be concerned about, in this county, we have some uniquely large and important special districts.
All right. If there's no further questions, thank you very much for your time today.
Thank you. And we'll move on to our final topic of the day, Clean Water Services, update on Cedar Mill Trunk Jenkins to Beaverton Interceptor.
Speaking of special and large special districts,
Welcome.
Good afternoon, Chair Harrington, members of the board. Thank you for having us here this afternoon. We're excited about the project that we have coming up. This is the Cedar Mill Creek, and it's an integrated project, both a water resources project as well as a sanitary sewer project. This goes, you're familiar with the area, this is just south of Jenkins Road, next to Reesers, and just north and into the Tualatin Hills Nature Park. So we've been working very cooperatively with a lot of project partners on this, including Tualatin Hills Parks and Recreation District. And this is also a critical piece in one of the projects associated with the Tualatin Watershed Enhancement Collaborative. So that is a aspect of this that the partners are involved with. You will see some legislation coming before you in the coming weeks that Brad Crement, who is here with me today, will talk about two aspects that will need board approval. So with that, I'll turn it over to Brad to talk about those different issues.
Okay, is there a way we can advance the slides? Okay, thank you. Okay, so I think Andy gave us a little bit of the project background. So it's really a three-headed project. We're working with two other big partners, Washington County LUT and Tualatin Hills Park and Recreation District. Those three components, the first one is a 40-inch diameter sanitary trunk line that we're going to be installing. The second one is a corridor enhancement project, which we're partnering with Washington County LUT. And then the third one, which isn't listed on the slide, is a lot of park improvements, trail and boardwalks through the Tualatin Hills Nature Park that we've been working with the Park District on. Next slide, please. And so on this slide, on this map, what we're wanting to point out here is how the project goes through the nature park. So the nature park is kind of the green treed area, which takes up most of the page. We basically split that park in half with our project. The red lines shown on the map are all the trails and boardwalks that we're impacting. So you can see we're impacting about 5 different trails, which would split the park in half, which is why we're really collaborating closely with the park department. Next slide. And then TWEC, Andy already covered this, so we can go ahead and skip a couple slides. One more. And so with THPRD, the nature park is their largest and most used park in their district with over 500 visitors a day, so it was very important to them. And knowing that, we reached out to them very early in the project process before we even started and had them part of our decision-making process. So we had significant public outreach to many of the residents and park users to try to help us identify the preferred alternative. And with that, we came up with a plan to replace the line adjacent to the existing to minimize impacts to the park and to the wildlife as well. Next slide, please. But in order for us to use this new alignment, we were in need of new easements, both permanent easements for the new line and construction easements to construct it. So with this, we are working on an IGA with THPRD, which will be a no-cost IGA, where they will grant us the easements, and in return, we'll do some boardwalk and trail improvements when we're done with the project. Go to the next slide. The other important thing on the IGA is it's going to help us coordinate our trail access. So there's, like we mentioned, several trails that will be closing. So we want to work closely with THPRD to make sure that we're trying to keep certain parts of the park open at all times so that people can still continue to use it while we have the construction for almost 2 years. The third piece there is improving accessibility just for our sewer maintenance. Currently, the boardwalks shown in the picture there are narrow wood boardwalks. We're not able to get any of our maintenance equipment down those trails. And so with the improvements to the trails, we'll be able to have better maintenance access in the future. The second thing that that's the IGA with THPRD that we'll be bringing to you in about a month or two. The next thing that we're wanting to talk to you about is the competitive bidding waiver, which we are planning to bring to you in the next week or two. I believe actually May 5th. And so with this, we're requesting a waiver to the competitive bidding process so that we can follow a construction manager CMGC type of solicitation. And what this does is it lets us look at more than just cost when we select the contractor to build the project for us. The typical design, bid, build structure is cost only. And in this format, we'll be able to look at their qualifications and experience, and then their work plan on how they plan on sequencing the construction, which is going to be important in keeping the park open. Next slide, please. And so why this is really important on this particular project is one was the project sequencing, which I just mentioned. The second is early bid packages. So we have several items that are outside of wetlands and natural resource areas that we can get done early. So with going with the CMGC format, we can do early bid packages to keep work moving ahead. The third item is very narrow work corridors. So while we're trying to avoid impacts to the environment, we have to narrow up the work corridor. And usually when we do this, this requires, we get higher bid results because they're not able to work quite as quickly when they're confined. And so we wind up seeing a lot higher bid prices. With the CMGC format, we can work with the contractor ahead of time to kind of plan these things out and help prevent some of those costs. The last item is the potential for groundwater and poor soils. So we are in a floodplain, most of the projects, so we're anticipating really poor soil and digging conditions. This again would usually result in really high bid results or a lot of change orders. So going with the CMG format will allow us to get ahead of those and deal with those ahead of time. Next slide, please. And so with that, really the future board agenda items that we have planned, the first is the waiver that I mentioned, which is going to be presented to you on May 5th. The second is the IGA with THPRD, which we are tentatively scheduled towards the end of May, maybe beginning of June. We're currently working out the last final kinks with THPRD on the final version of that IGA. And due to COVID-19, they're not able to respond quite as quickly. They're pretty overwhelmed at the moment. And so it may take a little longer than we originally anticipated. The third item would be after we get the proposals and select the CMGC contractor, we would come back to the board for a contract request. And then the last item that we would do on this project would be the actual construction contract, which would be towards the end of 2020. And that's what we have. Have any questions?
Any questions, board members?
A couple of three real quickly. One, is there any other improvements being made other than the line? There's no storm run or retention ponds or anything we're asking to do, strictly a line going through the park?
Yeah, so we're doing quite a bit of enhancement work, which is doing a lot of work to the stream itself. So some of that is installing woody debris in Cedar Creek, trying to get it to reactivate into the floodplain. The second thing is installing a bunch of high flow channels so that that water, when it does elevate after we install the woody debris, has somewhere to go. And so those are how we're dealing with stormwater management. There's no ponds or swells or anything associated with it. It's all very natural.
That makes sense. That's a good. And secondly, the line sizing. I can remember when we put 36 in, we thought that was humongous. Now we're getting up bigger. What's the projection on the life of this one?
So our modeling shows that it would be at capacity deficient in 2025, although we don't totally rely.
The 36 one or the 42 one?
The 36.
Put a new one in it 5 years ago. Yeah.
No, we're showing that the 36 would be capacity deficient in 2025, but we don't rely just on the models. We look also at flow meters. So we have flow meters on this line. We've been monitoring those for a long time. During peak events, we're seeing surcharge conditions in the line. The third item is really the opportunity to work with Washington County LUT on this project. So we saw they had a need to address their hydromod requirements. And so they were going to have to put in large detention vaults, which are expensive and hard to maintain. And so we partnered with them to come up with a better ecological solution, which is the corridor enhancements. Since we saw that the corridor enhancements and the sanitary, we wanted to make sure we got the sanitary addressed before we did any enhancements. So that kind of brought the sewer work to the top of the list.
Yeah, just to follow up, because I don't think I got the answer that I was asking, answers I was asking. For the new line, with projected growth that we have in Washington County and continued growth, what's the projected life of that line before something has to be bigger?
So we have designed it.
26, I hope.
No, we have designed that for build out of the entire drainage basin that is tributary to it. And theoretically, when it was initially designed, it was designed for the whole drainage basin. But of course, with densification over the years, it did reach its capacity. So we have anticipated much denser development, but full development of the drainage basin. So the sewer itself will have at least a 100-year design life and hopefully capacity to match that.
Just briefly, could you again kind of go over how you define the contract manager, general contractor form of bidding as opposed to the normal?
Yeah, so for the CMGC format, what we would do is request proposals from contractors to come in and tell us how they would, one, construct the project, and then also their qualifications on working on similar projects in similar situations. With that, we would be able to score the proposals and take that in consideration with costs. So we will also ask for costs for pre-construction services. And so we have those three different things that we can weigh together in order to select the contractor.
So it won't just be cost that's going to drive this.
That's correct.
We're looking for qualified people to do this very highly sensitive kind of work.
That's correct.
Generally in this, they don't give us the full bid for the exact cost of the project. They show what their markups will be, because then we work with the contractor throughout the remainder of the design, the sequencing phase, as partners with them, so that they know exactly what is expected of them through that partnership. And then when we come back to you later, we will know that what we call the guaranteed maximum cost, or GMC. So that initial proposal that they're giving us is reflecting markups that they will have on it. We'll be able to compare those, but won't have the full project cost at that point, at the time that we take proposals.
Value engineering is another benefit of CMG format. So we have when we have the contractor on forward, he's thinking of how to build things, and so we can take that into account in the final design. Right now, we're currently about 60% design, so having the contractor on board will allow us to make some final modifications to the design, which may help drive costs down.
Thank you.
Any other questions from board members? I have a couple. I'm really relieved to hear about the timing of this, that the construction is not right on our doorstep, particularly as with the governor's stay home, save lives order, people have had to stay within the local area. And the nature park is very popular right now because people can't travel to go hiking or be amongst the trees outside of our urban area. So it's a relief to hear that it will continue to be open for at least several more months. And hopefully we'll be out of the stay home, save lives order by then. A question that I have is with regard to what the allowed procurement policies are, both to incentivize but also require COVID firm utilization during the construction, whether it's directly by the contractor or through their subcontractors.
So if I understand your question, are there aspects to the...
I didn't mean COVID. Good heavens. COVID. Thank you. Boy, that was quite a slip, wasn't it?
When they rhyme like that, and what we're dealing with 90% of the time is COVID, understandable. So if I understand your question, we will be taking bids from primary consultants or contractors who will then, it can possibly team with subconsult or contractors to work on the project. We will see what the status of the COVID activities are at that point as far as additional provisions to add to the contract that may be necessary if the contractor is affected by COVID-related items.
Okay, I'm interested in COVID, and particularly that we would provide additional points for firms that are hiring the certified minority women and emerging small business firms for utilization on the project. That's common in the new landscape of CMGC contracts throughout our Tri-County metropolitan area. So that's what I'm inquiring about, even though I made the tongue slip.
We haven't developed the full list of criteria yet. We have some general scoring criteria for it. If that is something that the board desires, that is certainly something that we can build into the scoring criteria for selection of the contractor.
Well, it is a way for us to advance the trade utilization of historically marginalized members of our community, as well as small emerging firms here in our general area. So I know we've had some extensive discussions with Washington County's procurement group to get working on that. And as CMGC contracts come before me, I'm going to be continuing to ask about what our implementation plans are. That was it for me for questions. I know it's a really complex area, so thank you for being on top of all of these considerations.
Okay, thank you.
All right, that's it for all the items on our agenda today. Are there any final closing items from commissioners or leadership? No? Well, then that's Commissioner Treese.
I'm going to be on Zoom tonight,
Great.
so I'll let you know.
Great. So it'll be our first meeting of having a member on the video conference. So just like when we had a phone conference, I'm going to be pretty judicious about asking to see if there are any questions or comments. Hopefully I won't mess up too many times, but I think we have a pretty straightforward agenda today, so it'll be good practice for me. Anything else? Okay, terrific. Thank you.